This is Dalil Lala, and welcome to another episode of Lab Matters. I'm thrilled to have our guest today, Dr. Musaid Abrams, at Musaid Abrams on Twitter. Dr. Musaid Abrams is the founder and CEO of Aviro Health, established in 2012, an innovative medical design company that utilizes digital tools to democratize access to healthcare. He holds an MBCHB from the University of Cape Town and is a graduate of Harvard Business School as well as Yale University. Musaid has worked in the medical field since 2001, in the non-profit sector for MSF since 2008, and has held various consulting positions since 2016. Musaid, welcome to the show.
Thanks, Dalil.
So, right. So, what is Aviro Health? Right. What is Aviro? How do you say it? Aviro.
Yeah. Right.
What is Aviro Health?
Well, Aviro Health started as a consultancy, as you said, in 2012. What I was looking for at the time, my background was working in the public sector here in South Africa, public health sector. I started in 2001 working in HIV. And then I went on to work for Médecins Sans Frontières, Doctors Without Borders in 2008. And based on those experiences, what I thought was lacking was that we needed an approach to digital design and digital technology in health that encompassed both sort of empathy, sort of putting the user first, and technology and data. So using the two, that's what we formed in Aviro Health. So at the moment, our mission actually is in Aviro Health is to take people through health journeys, right? Through their health journeys for an improved health outcome. The way we do that is we give patients the right information at the right time, right? To prompt them to go forward in their health journey. And we also try to smooth that path, right? To remove friction points for them to reach their health journey and the outcome, which we call linkage to care.
All right. Wow. Let's just unpack that a little bit. So Aviro Health is essentially at the confluence of digital innovation or digital systems and sort of healthcare or access to healthcare. So what does that look like practically? I'm just trying to picture it in my mind. Who would you be serving, or who do you serve, and what do these systems look like, and how are they better than what currently exists?
So I think to take that question, we first have to look at the problems that we're looking to focus on. And I would say it started out in HIV because that's my background, that's my network, that's what I saw, right? The challenges in HIV is that you have a patient, right? They get certain triggers or awareness around the fact that they need an HIV test, for instance, right? They then have to go to a public health facility, usually waiting for the whole day in that public health facility. At that public health facility, they get counseled, right? The problem at the moment with counseling is that you have quite a high turnover of staff, so the quality is variable. There's not a standardized counseling system, right? And then from that point onwards, you then go into linkage to care, which is linkage to the healthcare worker if you're positive. So what we're looking at in a very practical way, we support with the demand generation, right? Yeah. So we have demand generation materials up in the facility. We have digitized the counseling process, so the counseling and screening process. So we have a tablet app, for instance, outside a facility where patients are registered. They then they look at a video counseling syllabus. Importantly, the video counseling syllabus is in the language of their choice, right? So it's a video counseling syllabus in the language of their choice. They go through that experience. Only if they need, actually personalized counseling, then they do have that counselor on hand to address that. And then they go link to care. So what we're doing on certain aspects and feedback that we get through the system, we call it Pocket Clinic. The feedback that we get is that there are more patients interested because actually it's a digital tool, right? They're also interested because They don't have to wait long in any kind of queues or lines. So they don't take a whole day at the public health facility. And then lastly, there's a perceived stigma around and a concern about privacy and confidentiality on the patient's part. They're going to a public health facility. They think they know the counselor.
Yeah.
The counselor is going to divulge the information. Because they're interacting with a digital tool, they have less fear of that. And we see that in our results, right? So when we started this out, we wanted more, we were trying to focus, actually, the public health sector is focusing on trying to get more males to test, for instance, and more young people. So we saw when we ran a pilot with John Hopkins and Autumn in Gauteng, that when we instituted this digital tool, that about 20% of males, 20% more males tested, right? And we can see it in all our other projects as well when they use Pocket Clinic. So that's just an example of how we're taking somebody through a health journey, right? From the demand generation, through the counseling, and then through the linkage to care.
Interesting. I read a study regarding chatbots, right? And I'm not sure if is Aviro Health sort of makes use of a chatbot, I'm sure in some way.
Yeah.
Right?
We've used, sorry, was that the question?
No. So what I was leading up to is that apparently more industries are using chatbots because of exactly what you said about honesty, right? So I think intuitively you'd think that speaking to a machine, if someone knows that they're speaking to a computer or to a machine, they're not going to take it seriously. But actually, what studies do prove is that they understand that it's not a human. Yeah. So they're more likely to be, honest, open and honest with the answers to get the help that they need. So apparently they started using this in the financial sector as well. When you're trying to get home loans or whatever, just because people seem to be a lot more comfortable chatting to a chatbot with personal things like this.
Yeah, and just to delve into that a bit deeper, if you the example that I gave you was the tablet app, which is outside a health facility.
Yeah.
You did mention that we use chatbots. We've used chatbots 3 times. One was to support HIV self-testing. So a patient would get a kit, they'd register on the chatbot and go home and test and then go through the counseling syllabus on the chatbot. Mm-hmm. Now, in that respect, when we first did our design, we sort of personalized the message and we said something, I'm going to give an example, but it said something like, I'm Sister Mpumi and I'm going to give you advice. But actually, from the feedback from the user, workshops that we did, and the feedback from patients, they thought that was a real person and they didn't want to divulge the information.
Wow.
So they actually want to know that it's a bot.
Yeah.
Like you're saying, they want the anonymity,
yes,
and the privacy. So we've gotten feedback on both sides actually that, especially males, I would say. In Kenya, we had full user workshops, focus groups, etc. We had focus groups, etc., where they said, I thought the person registering me was the chatbot. So we had to make it clear in the initial messaging that, you're speaking to a bot and that your information is private and confidential. A lot of the anecdotal evidence that we have from the tablet app actually is that males prefer not to speak to a counselor, right? Because they think they actually like watching a video and then only asking questions at certain points. Because again, it's this feeling. Actually, the feedback was that males don't want females to know that they are feeling emotional, like if they have a positive test or something. So yes, it's quite interesting, and it was quite eye-opening actually for me that they trust the chatbot.
So how did you overcome that? Because the advice that I found out, like when doing this research, was actually to name your chatbot. So like hi, welcome to Aviro Health chatbot.
Yes,
be like extremely clear about that.
Yes, so, no, exactly. I mean, we're working with public health sector clients a lot of the time, right? So that there are certain things that establish credibility, trust. For a large part of the population, actually having an official sort of National Department of Health or Ministry of Health, affiliation with the logo, it actually means quite a lot. to the cohort of patients that we're talking about. The other one is actually naming it a bot and being clear that it is a bot. And being also clear when you're passing that patient on to a live person, because patients will go up to a bot to a certain point, and some of them want to engage with the live person, right? And then saying, okay, if you type help, you're going over to a live chat line, and that is a person.
Okay.
But it's about being clear and transparent.
Yeah, that's really interesting. I feel like, there's a lot of counterintuitive insights you get when you actually do the testing, the field testing.
Yes.
Because, I mean, like you said, the insights that you got from the males versus the females, was there a large difference between the two groups?
We actually didn't look. We didn't in the Kenya case study.
Yeah,
that was only looking at males. So they were trying to increase male testing and male reporting of results.
All right.
So that was specifically, those focus groups were specifically males.
Okay. Okay. So, what we're speaking about now is that obviously the importance of testing out in the field, getting feedback, refining, and that sort of leads into this concept of empathy, right? Especially when you are developing a new product or entering the market with something that hasn't been done before. So how does empathy inform the decision making at Aviro Health?
Yeah, I think just as a doctor, it was eye-opening for me. I had one eye-opening experience. I actually got asked about this the other day. But I had one eye-opening experience. I had to go into a clinic in Kailicha, a youth clinic, right? And I had to basically observe the youth and ask them some questions, right? Because I had to present at a big HIV youth symposium. They decided, let me rather go on the ground and find out some things for myself.
Yeah.
So I go into this youth clinic and I sit there and I'm sitting with these young girls, right? So it's 95% of patients at youth clinics are actually female. So I'm sitting there and, it's quite an open plan design, And so the girls, they're sitting with me and they're saying, you see that girl? She walked into that room and she stayed there for 5 minutes. She's going there for family planning, She's going for an injection.
Yeah.
It's simple and it's fast and she's leaving. You see that girl, she stayed in there for half an hour. She's got HIV, right? And this is the experience that they're feeling, right, outside. Yeah. And they're watching. So if you don't put yourself in the shoes of the patient, you don't understand. The other experience that I had was that a mentor of mine, Sister Mpumi, she worked at Kailicha. She was our nurse manager. But what she did was she had an open door policy where patients could complain or could come ask for anything at a certain point in time in the day. And she said patients would come in, and actually what they were saying was, we can't spend the whole day waiting for tablets, waiting for our medication. Wow. And she responded to that by opening up the clinic earlier at about 7:00, taking out all the medications for those chronic patients the day before, and patients just coming in and she's giving them quickly. And if they had a problem, they'd have to wait for the doctor, right? But if they didn't have a problem, they'd go on their way.
Interesting.
And so that whole model actually of care has become an official model of care, right? It's called adherence clubs, but it's actually to retain patients by giving them medication quickly. So those two experiences actually, they opened my eyes to the concept of user design, about asking patients, about asking users, right? What they require, what the experience of care is, and trying to bring care to them where they are. And so this whole thing about supporting patients on health journeys means trying to actually move care out of the facilities and closer to patients, right? Wherever that may be. It might be at home, it might be at the workplace, it might be at a pharmacy, but it doesn't necessarily have to be at a clinic, right? It's similar to banking, where banking was 15 years or 20 years ago, right? You hardly ever go into a bank now. Everything is digitized, right? And there's a certain amount of trust from everybody, but it took quite a while to get there. So that's what we're trying to do. It's trying to, bring care close to the patient because we're listening to patients. And I'd say empathy is one word for it, right? It's about understanding and about seeing what are the goals of the healthcare provider and what are the goals of the patient, and trying to meet it halfway. And we've had many occasions where, and that's where we start, right? It's the hard work actually is to do user design workshops. They're quite time consuming. You're getting glimpses of insights. And I would say the balance in Aviro, this is what we're talking about, balancing the user design and the empathy with technology and data. Is, can you have some insights? Can you create something, right? But then can you use data to prove that actually, that assumption that you had, was proven out by the data. Yeah. And that has been a lesson for us. You can't just sort of go the user design way and just leave people with personas and insights. I would say our impetus is use persona and insights to create, a tool, a piece of content, and then measure if it works,
Yeah.
And that measurement is great to do with technology, actually.
Yeah. So there's a lot of, I'm sure there's a lot of challenges that you guys faced, specifically with, I feel like as a creator of something or a designer of something, sometimes it's difficult to let your own ideas go. And as you go along the journey of creating something and looking at the reaction from people, it's oftentimes I'd say that you look away from yourself and look at the issues out there and see what's wrong with them. Why aren't they understanding what I'm doing, or why aren't they using the app? And it takes a lot to step back and really look at the nitty-gritty and try to understand the underlying issues. So, for instance, you were speaking about these girls at the school that were noticing their peers, going into this medical or this clinic, and obviously that's something that those girls would like to avoid themselves. You'd like to have that privacy, that anonymity. So, and I guess this is where the healthcare journey or the healthcare journey starts, right? So how does Aviro Health define that healthcare journey? Where does it start and where does it end? Does it ever end? And how do you make sure that these individuals actually get onto that journey or realize that they have a journey to start on, or they're actually part of a journey already?
That's a great question. We're still asking that question. No, it's a great question because it's the way that you define health journey. You're correct, and that's why the health journey doesn't start when you have made the decision, right? To go look for someone, or to go see about a mole on your skin or something, right? It starts before that when the awareness is raised, and that's why demand generation. You can call it marketing in normal private sector speak, but the demand generation is actually where the journey starts, right? It's the awareness that I may be at risk of something and that I need to check it out. So, like the question at that point is why was that triggered in your mind? It's probably because I raised some kind of risk factor to you, because this is what happens when you go to a doctor, right? You're going for your cough or cold or flu. But they know that you're a certain demographic, you're a certain age, and that you might be at risk of something else, and you have a certain family history, and that's where the journey starts in the healthcare worker's mind, right? It's saying, oh, I might have to raise this with this patient. Now, how do you do that when we're trying to bring care outside of a facility before you even get there? It's probably through demand generation materials. So be that posters, videos, it doesn't matter what, radio shows. It's some kind of awareness raising, right? Oh, it's breast cancer week. Oh, maybe I should go have my breast examined because this was brought up. So it starts at the demand generation. Now the challenge actually is how do I individualize the information to you so that you think, oh, this is pertinent to you, and you move down that care journey. Because the next part is screening, right? So in our mind, screening could be taken out of the facility or even out of the healthcare provider's hands. making it available as HIV self-testing shows, right? You're doing a self-test or COVID self-test, right? You're taking it out of, it's going outside the facility now. You can find it at a pharmacy or on Take-A-Lot, right? And then that's a screening test. Then you get diagnosis. But when you come to starting diagnosis and treatment, that's when you have to link to care in some way. So this is the point where I might have made a self-diagnosis, or I might have screened myself on some, web questionnaire around mental health. But now I'm going to take that information and want to go link to care. And that's the important part, right? That's the part that we can measure. Did you find the service? Can I tell you where the service is? Can I make it easy for you to get to the service? Can you book an appointment? Can you do all of these things, right? And then you link to care. And that's how you prove a measurable health outcome.
Okay.
Is how many people have actually taken a step to link to care. So in HIV, for instance, the linkage to care happens when patients go into a facility and they confirm their result. So that's when they confirm their result and they're positive and now they're part of the system. That's when the linkage to care is happening,
So that linkage to care, is this a matter of Aviro Health sort of partnering up with clinics or with doctors? What does that transition look like for someone on their healthcare journey or health journey?
So I'll give you an example, so we're B2B2C, right? So that means the NGOs, and it's largely NGOs, and now we're going into the private sector as well. The clients that we work with, they have access to the patients. So they're going through the tablet, they're going through a WhatsApp chatbot, they're doing the test, and then that client is connected sort of either with the National Department of Health or the Ministry of Health clinics, and they can point the patients in that direction. But we can measure that linkage to care, that drop-off rate.
Okay.
And in private, what we're looking to support are more wellness days. So, partnering up with sort of big providers of wellness days. So, and that's what happens at a wellness day now. Actually, at the moment, is you have a screening for, your blood pressure, your HCT or your HIV test, and then you link to a provider. So that's our two models at the moment that we're looking to expand on.
And you say that you focused on, or you started with HIV. When did you start with HIV in Aviro Health, right? Creating the product, and then where's it going? Are you expanding your areas of expertise, or expanding the availability of those other healthcare journeys?
So, and I have to make the discrepancy. And you asked a good question before, or you were going to ask the question, I think, when you're saying, what if somebody doesn't use what you think is necessary?
Yeah.
Right? So when I started Aviro, actually, it was me alone. It was myself.
Okay.
Right. And bootstrapped it and actually made a decision support tool for HIV nurses and doctors to prescribe ARVs. But it was 2012 and it was too early.
Okay.
Right. It didn't have a good uptake, but it was the base of which we were starting to do things, but it didn't have a good uptake, but you learn lessons along the way. Right. And then I would say the important inflection actually is meeting my business partner, Luke, about 4 to 5 years ago. We both got healthcare experience, but we come from different parts of the healthcare experience, and I think that tension is good because we're always sort of checking each other and we're always asking, is the assumption that we have, was it borne out? Was it proven or not? Sorry, I'm actually just lost the question there because you.
No, so I wanted to know, you started out with HIV.
Oh, yes.
Right? And then the journey of that, and then the other areas that you are.
So we had done a lot of user design work in HIV for Médecins Sans Frontières, for Doctors Without Borders, around creating a youth HIV video syllabus, right?
Okay.
Then we created an adult HIV video syllabus for the National Department of Health. So we had a lot of background knowledge now of HIV and a network. So we decided, and then we made Pocket Clinic, the platform, right, in which to carry this information, right? Whether it's copy, whether it's voice, whether it's video, Pocket Clinic can do that, and the system assists that measuring of health outcomes, right? But the technology is agnostic, right? So it doesn't matter which disease it is, right? The patient journey is the same, right? It's awareness, it's screening, it's diagnosis, and it's linkage to care and then treatment. So what we did was, and this was sort of just after COVID, we got some funding from Tuks University into looking how to support another disease vertical. So HIV and TB are largely on your infectious diseases side, whereas your NCDs, your non-communicable diseases, right? Diabetes, hypertension, cancers, are your NCDs. We wanted to explore a different vertical. So they gave us some funding to explore a vertical, and we chose diabetes because Tuks University had approached us to look into using Pocket Clinic to support diabetes. And that's what we're going to be launching next month, actually. In the pilot's going to be launching next month in some clinics.
Interesting.
Yeah.
All right. So there's 2 verticals now.
Yeah.
Right. And obviously you build upon those, and that's really interesting. So what kind of interest has Aviro Health garnered from the investors or private, public? What's the sense there right now? Because obviously you said you started in 2012, right? And you've built something that seems to be beneficial to a lot of people. Are the hospitals, are the clinics, the government, is there any interest in this?
Yeah. So, I mean, just to make a line in the sand, I would say from 2016 onwards, that's when my partner joined and we focused on Pocket Clinic, right? At that stage, we built an MVP. We had seed funding, we built an MVP. We had a proof of concept, as I said, with John Hopkins, which was successful with that client. And that client was going to scale to 100 clinics, right? Oh. And we were pretty excited. And then COVID hit. And, there were budget cuts, and that contract was put away. And it was I would say it was quite a blow to us at that time.
Definitely.
At the same time, though, we got investment from ASISA, which is a part of Edge Growth, the ASISA fund. We got that initial investment, and we built with that investment, we built on the MVP. So we replatformed. It was quite, we replatformed. It's a difficult process.
So are you, when you say replatform, are you saying that you started from scratch, or like you sort of had to redesign the product in a different language, or more scalable?
Yes, more scalable version.
Okay.
So the MVP that we had, it was on Google Cloud, right? It could only handle, I would say, at that moment, it would only be able to handle 8 clients.
Okay.
Right. And it was good enough for the MVP. It wasn't good enough to scale, however, right? It would take quite a long time to onboard a new journey with a new client. Talking about around 2 months, so between 8 and 10 weeks it would take, right?
The clients. Sorry to cut you there. The clients. Yeah. Are you talking about B2B clients?
Yes, B2B clients.
Okay, sorry.
Yeah. No. So the B2B clients, we'd onboard a different B2B client. But it would take quite a long to set up the data structures, all of those things for new clients. What we have now in Pocket Clinic, it's on Amazon Web Service. It's infinitely scalable, actually, right? And it's brought down the production of a new instance or of a new onboarding of clients. So today, if you told me, I need this Pocket Clinic with exactly the same journey, right, as a different client, we're able to put you on in 1.5 days, roundabout.
Wow.
Right? So that's the massive difference that we're talking about now. In addition, you learn from the mistakes of before, right? So in terms of the database and how to structure the database. But again, I think a company is all about people. Yeah. So we have the right, Ahmed was our CTO. He was the previous head of architecture at Allen Gray. He joined the team.
Okay.
Right? Now the data structure is sorted out. So it's just to get your point back to the investors, we had to take that time to replatform.
Okay.
Because otherwise we wouldn't be able to scale properly. Right? So we had an investment in we had a different investor in Aviro Foundation. They're also looking to make a big impact in health, and they saw the inflection point that we were at. And then we had also sort of grant support from Grand Challenges Canada. They first, they supported the MVP, and then they supported the scale up. So I think the mixture of sort of grant funding and investor funding was important. The challenge for the next, actually, is before you get to a Series A, is to sign many more clients. And I think what investors want to see is you signing clients on the commercial side, right, on the private sector side, not on the NGO side as much. And I think that's the challenge that we're in at the moment. Signing more clients, making those proof of seeing that product market fit.
Interesting. Yeah, finding business, that's obviously what attracts investment, which is, I guess it's a part of scaling. But it's really interesting because, there's a balance that you have to sort of consider as an entrepreneur and getting investment in, obviously, everyone wants to make a good return on the investment, and it's kind of tough in a field that you are essentially you're creating a new market, right? It's not a tried and tested way of doing things in South Africa, in the field. You're really pushing boundaries. I guess you're really making a new way for this field, and I feel like there might be a lot of opportunities for other partners to come on board, because essentially the platform that you're building or that you've built is, as you said, it's infinitely scalable, right? And I'm thinking that other healthcare professionals, hospitals, clinics, in a sense, the service that you're bringing is that from a medical care provider's point of view, it's that you are essentially creating lead generation for them.
Yeah.
Right. So obviously hospitals need to be busy. Medical practitioners need to be busy. And this is a form of lead generation. So have you pitched that, or have you sort of taken that approach to, actually what would the relationship be for a clinic? And what would that relationship look like between a clinic and Aviro Health? Would they have to, have to pay a monthly subscription to be part of your database? Do you have a database that connects patients to doctors, or what would that look like?
So those are all the questions that are going to come up on the private side. Okay. Right. And that's why we're going with a partnership. We'll announce it soon. I think in the next 2 months. I can't mention it now.
Okay, so I've scratched something. Eh?
Yeah.
Okay.
No. That's good, right? So that is what you're thinking on the private side. Yeah. Actually, is that there is an opportunity for lead generation that is separate to the B2B.
Yeah.
You understand? Where patients are going through a health journey, and all you're doing actually is linking them because they've come through your funnel.
Exactly.
Right. And I think that is what we're going to explore in the next in the next quarter, actually. So one of the challenges that we have is there's always a temptation. You see these ideas and then you think, okay, I need to jump on that. And in a certain sense, you have to do an experiment in it. So the idea here is that what I'm thinking here is, and something that we discuss, in the company, but you have your B2B, right? And what you want to do is you want that to work very, very well. So you actually have to specialize in that. And this part here that you're talking about is more B2C, right? Something that we don't have experience in, something that we actually should do an experiment in, because it makes intuitive sense that you'd have a database of locations, and you you'd funnel people through a journey, and they can actually get, a pregnancy test, an HIV test, any kind of test at a certain place, right? And that's actually one of the experiments that we are going to run.
Interesting. Yeah, it just opens up a world of opportunity.
Yeah, I just think there's always a tension between like focus and getting strong and good at something.
Yeah,
and being
absolutely.
open, because as an entrepreneur, you actually always you're always seeing the next thing on the horizon. You're always seeing the opportunity, but there's always opportunity costs, So, and so that I think that is the tension,
And I mean, currently the way that Aviro Health is sort of positioned, is it sort of more towards the low income bracket of, right?
Yeah.
And then what about the other side of that, the 2% of patients that would also like us, like a healthcare journey that is, really private or.
Yeah. So I think our focus is on the lower middle income, right? And I think that's where a lot of our expertise lies. And this is where I sometimes think that, for Aviro, there's Aviro, the company, and then there's the platform. They're two separate things, right? But we are sort of a client of this platform. We are using the platform.
Yes.
But someone else might want to use the platform with their expertise.
Okay.
Do you understand? But this is our expertise at the moment. HIV, lower middle income. I'll say, we're trying to focus on stigmatized diseases. All those diseases that you think, I want to be private and confidential and anonymous about. That's what we're trying to look at, the stigmatized diseases in emerging markets. Now, and a different company might have an expertise in the 2%, and they might see the platform as useful for that, and they don't want to build it out themselves, right? Should they be able to use it? My answer, I think, is yes. Should you license it, et cetera, et cetera. So that is, in my mind, those are all possibilities, right? Yeah. But I think it's a mistake to just spread yourself too thin, to decide, I'm going to do lower middle income, but I'm going to try to go for 2%.
Yeah.
Or I'm going to try to go for multiple disease verticals. In theory, you could, but what are you strong at, And what do you care the most about?
And I like the fact that Aviro is a platform, right? It obviously privately owned. It's your Aviro Health platform, right? Yes. But eventually, I'm sure you guys are having talks about, as you said, make it, a service, right, to other companies or other healthcare institutes that would like to sort of make use of a platform like this.
Yeah.
And I guess make it a lot more sustainable in the long run. Yeah. Because, obviously different income generation.
Exactly. Another stream, right?
Another stream.
So I think, it's like Luke likes to say, we're not a technology company. We're a, tech-enabled health company, right? There's a difference in that, There are a lot of technology companies that are doing health.
Yeah.
But they're technology from the ground up. And then sometimes it shows in the care, patient that's provided. We're a tech-enabled health company. So the health outcomes are what matter to us first, and building the structure for that means that you're having just the technology enabling those health outcomes. But we're quite free on thinking about how do you get to those health outcomes. But if you're a technology company first, you have to think about your platform first.
Yeah.
And I think that is the difference, and it's a key like line in the sand that you're drawing. So when people only want the technology, perhaps you need an avenue for that. You do have, it's an asset. It's there. How much do you do you consider white labeling, do you joint venture, all of those different things?
I mean, it goes back to that example of Sister, what is her name? Your mentor? Sister Mpumi.
Sister Mpumi.
Sister Mpumi. Yeah. So she came up with that idea of, putting certain patients on a speed track to getting what they need when they need it, and then, sort of separating that. And that can obviously, you know, that comes from a healthcare perspective's point of view, you know, understanding what the issue is. And obviously, you know, you could probably enable that with technology as well to build it out, build the systems to facilitate something like that, right? Whatever that looks like, you know, obviously, I don't know if you said it, but, you know, being tech agnostic in a sense, just making sure that whatever needs to be done is enabled with the technology, whatever that technology is, you open up for that. You open up to that.
Yeah, exactly. So, I mean, just on a very practical level, we started out building a PWA, a web app for patients to take home on their smartphones, right? But the response from the patients that we were working with is that they wanted a WhatsApp chatbot, because that's what they were used to.
Yeah,
that was the technology that they were accustomed to. So we created those WhatsApp chatbots, you know, and even now we're going to go forward, and we're deciding whether you should go chatbot route or whether you should still go a PWA route, because there are concerns about data privacy on WhatsApp, especially when it's health information, you know, but it's something that we're going to strategize around and then come up with what our plan is, you know, but yes, tech agnostic.
Interesting. Okay. So let's take a break from the business side of things and sort of explore you as an entrepreneur. You know, obviously you come from a medical background, and you touched on the journey that you took to get into, you know, the entrepreneurial route, you know. I want to know, in your opinion, what's an important personality trait to have as someone that wants to be an entrepreneur in the healthcare industry or the healthcare sort of domain? Because I know there's a lot of red tape. I know it's very, very regulated. It's probably one of the most regulated areas in our country. So what are important personality traits or important things to consider when you delve into this, into the field?
I think one of the most important traits for an entrepreneur is self-awareness. You know, you have to know what your strengths are, what your weaknesses are, and do you need to supplement that, you know, with a co-founder or with your team? Like, how do you do that? You know, I think it's, you know, people believe that you have to be some sort of you know, solo entrepreneur and that it will lead to success. I think it's probably the opposite. You need to know yourself. You need to know yourself really well.
Understand what your weaknesses are, what your strengths are.
Yes, you really do, because you want somebody that comes from the same sort of mission background as you. So you agree on the mission, really, right? But they are different in you in the best ways possible, you know? Okay. So in my example, for instance, that's why I said Aviro started as a consultancy. It was only me focusing on user design, focusing on how to create technology. Then you get a co-founder, right? He comes with an MBA background, with some experience in startup and experience in corporate. And then the two of that together, actually, it's balancing things out, right? There's always a tension, but it's balancing. So I'd say that self-awareness is the first thing.
Okay.
Knowing why you're doing something, right? I think that, I mean, there's the usual other traits, like you think, like resilience and grit and all those things. But you must, for myself, I constantly question, you know, did I make the right decision? And what are the pointers of that, right? And there's a certain amount of optimism that you need, actually, right? Like a natural
constant optimism.
I feel like it's like a natural optimism that you kind of need, because you need to brush off quite a lot of failure.
Yeah.
Right? And try to see the next opportunity. I'm not saying you have to be stupid about things, but
unpopular opinion is that, well, look, failure leads to success. If you haven't failed, you know, you're not trying to create something new. And it's a matter of iteration. It's a matter of making a wrong turn and responding to it and getting back on track. And whatever that track is, you know, you only find out what that track is through failure and through, right?
Yeah. But I think the things that I've learned along the way is that you sort of have to dial in, you sort of have to get dialed into a pretty good like risk calculator, right? You don't want to make mistakes that you can't bounce back from, for instance.
Yes.
So if somebody doesn't tell you that, because I don't naturally think like that. I'm like an intuitive, right? I read a lot, I absorb a lot, and then I think I want to make decisions, you know. But if someone doesn't say, oh, you just use some sort of logic and the risk calculation a bit, you know.
I think it's also important to, you know, when I'm speaking about failures, I'd say failures in a controlled environment as much as possible. So for instance, you're creating your MVPs, but even before that, just, you know, playing around with ideas, workshopping, doing something in-house, going out, testing it, but obviously not committing to some huge idea that has a massive potential for, you know, failure because of your lack of planning or your lack of, you know, logical thinking. Right. So, okay.
So I think, and one of the other things that I would say is, which doesn't come naturally to me, and I don't know that it is, we're talking about health especially here. I don't know that it comes naturally to a lot of health professionals or doctors to be able to speak about your work.
Oh.
Yes, I don't know if it's a cultural South African thing or if it's actually health in general. You don't speak about, you know, whether you're a good doctor or not. But when you're part of a company or when you're starting a company, you do have to do good work and speak about it. Like, and I'm saying this as a challenge to myself because I constantly struggle to, you know, speak about the work that you're doing because that's marketing, PR, whatever it is. But I do think it's important for people to hear from you, right? You know, what you're representing, what the work is, what your brand is, what your results are, you know, because otherwise you can't, if you can't tell a good story, you can't continue.
Interesting. Can doctors tell good stories though?
Yeah, I think so.
They can. I think it's just a different platform, right?
Yeah, I think probably younger doctors are probably better at it.
Okay.
You know, I see people on social media. I think, oh, you know, some people have a natural knack for it.
Yeah.
Promotion, etc. But yeah, I think you can. I think, and I think it's a skill that you can learn. Or if you can't learn it yourself, you at least have to know enough about it to spot the team member that you need to do that.
Okay.
But it's a necessity for a successful business is to promote it.
Okay. So just one other thing, you know, going back to that, you know, a doctor can be considered in some way like a technician of the human body.
Yeah.
Right? And typically technicians like to do things themselves.
Yeah.
Have you felt that you sort of had to like let go in certain aspects of your business where you felt like, you know, you should do this or you should do that rather than asking someone else to assist you or sort of relying on someone else's specialities or something like that? Is that an issue at all in the beginning, at least?
I think it's always an issue because, especially I'm going to speak as a founder as well.
Yeah.
Because you're making the company and you're making the culture, right? And in some ways, it is largely a reflection of you and your co-founder in many ways, because you're going to make incremental decisions that are always going to be a reflection of who you actually are, you know? For just as a technician, yes, there are certain things that but I was also very specialized. So in some ways, if you're a medical person starting a technology, you know, enabled company, there are some things that are beyond your control in any case. Yeah. So those things are easier to let go. You know, I can say, oh, this is my CTO. He takes care of you know, the technology part. And it's easy to see that. Less easier to see control over is like some of the medical things that I, you know, that I'm in charge of. Right. But, you know, I haven't seen, the last patient that I saw was about 4 years ago. So just pre-COVID. Right. And I think the more I'm out of it, the more I'm easier about letting a specialist take care of that. But there's a way that I want something to be done. There's an approach that I want patients to be treated with, right? Which I don't always see and which I want to that is like the reflection of Aviro. People must be given care that is non-judgmental, that is equitable, right, and that is fair. And so that sort of impetus in me, it has to come through. Even if we hire another, like a chief medical officer, if I don't get somebody that has that same feeling, then I'm not going to hire that person. But I'm very conscious of the fact that, for instance, that I don't know the technical details of HIV anymore, and that we have to have a specialist in. But you must have. That's what I say. You have to know yourself. You have to know where your lines or your strengths are, right? And I know what I'm good at now, and I know what I'm not good at, right? And you have to cover that with other people who are good at it and who love those type of things, right? So there's a certain amount of ideation that I love, right?
Yeah.
Creativity, but not detail oriented. And actually, what I need to balance that out is with with a medical person with detail oriented, right? Because you are right. It's a highly regulated industry. You actually have to have all your checks and balances in place, right? So I think that's the dance. It's just knowing yourself properly.
Interesting. All right. So lastly, okay, we're going to sort of wind down now.
Yeah.
Okay. What book would you recommend the audience to pick up and read that sort of you feel that stuck to your journey or stuck with you during your journey and sort of added to this new world that you started experiencing after 2012, through this entrepreneurship journey?
Yeah. I mean, this question is a difficult one for me because I read a lot.
Okay. How about 3?
No, I'll give you 2. I'll give you 2 because these are the 2 of the highest on my mind.
Okay.
The one is Good to Great.
Okay.
Right? And I mean, it's kind of like a textbook for everybody, but it's really good. It's really well written.
Is it Good to Great?
Yeah.
Okay. And then?
Have you read it?
No, but I think I might have seen the book.
Jim Collins. So it's
Okay.
It's almost on every bookshelf.
Okay.
And it is that good. There are certain key principles that I think I always revisit, and I always come back to that, right? Even in the company, we talk about our hedgehog and we talk about the flywheel and all of these things, right? I must say that is about a company that's already good and taking it to great, right? Okay. So there's still that part where actually you in the early phases of your company trying to work out product market fit, right? And I think that's still a challenge. But I think Good to Great, continuously go back to Good to Great. Okay. The other one that I'm reading right now, which I wish, and I think today I told can you buy it for everyone in the company? Oh. It's called Build. It's written by Tony Fadell, who he was part of the team that created he's actually in charge of the team that created the iPod and then the iPhone, and then he created a company called Nest. I'm finding it. I honestly wish I had read this book at the beginning. There's so much information in the book. Like I'm talking about practical information about how to approach yourself, your health, your team, how to build your team, how to think about the product, how to launch the product. I wish I'd read this honestly 5 years ago. It is a great book. I think it particularly resonates with me because he has ADD and I have ADD. I think a lot of entrepreneurs actually do have ADHD. Yeah. But it does resonate with him because he speaks about it and he speaks about what he has to do to sort of mitigate it, etc. And what are strengths about it, So Good to Great and Bold by Tony Fadell.
Okay, noted. Gonna get those 2 books just for the record. Definitely give you some feedback and we can possibly discuss it in the future. All right, so thank you so much, Musaid, for spending this time with us this morning. I know you're an extremely busy guy with a lot of things to do, a lot of places to be. And the fact that you really spent some time with us, I really appreciate it. So I'd like to thank you on behalf of INDALO Bio and Lab Matters, the Lab Matters podcast. Where can listeners find you online?
So online, we can find the company information. It's www.avirohealth.com. I'm Musaid Abrams on LinkedIn. I think that's where actually most people find me, LinkedIn. And and Twitter sometimes. I would say it's not. I'm not on Twitter a lot, but I would say mostly LinkedIn beside Abrams. And I just want to thank you, Dalil, and Lab Matters. I think it is. I know you say I'm busy, but we're actually all busy, right? But it is good for me to even, think about some of these questions, reflect a bit about it, because it does help like crystallize your thinking,
Cool. Thank you so much.
Thanks, Dalil.
We're done. Thank you all for watching Lab Matters podcast. We'll be pushing out an episode every month, and follow us if you enjoyed it. Thanks.